I'm the president and founder of the Louisiana Center for Health Equity. We are a nonprofit organization based here in Baton Rouge, but we are a statewide organization, nonpartisan. We advocate for people all across the state of Louisiana to have better health outcomes and better quality of life.
Today, we are celebrating the 10th anniversary of the Women's Health Day at the state capitol. And we are so excited that we have been able to have 10 years of convening women advocates, partners, to be here to speak about women's health and to promote women's health in the state of Louisiana.
One of the biggest issues facing women in Louisiana is just the disparities that we see across demographics, and that includes by race, by place. We know that rural communities do not have the same access to quality health care services. We actually have areas in our state that do not have access to maternal services, health service, OBGYN services, so we call those deserts. And so we know that we have a lot of work to do, demographics in terms of poverty and socioeconomic status. We have a lot of work to do in Louisiana to lift up everyone so that our state has better health outcomes, and we're ranked better among our peers across the country.
Good morning, everyone.
Good morning.
Thank you all for being here. This morning, I bring you greetings from the Louisiana Center for Health Equity's Board of Directors. I stand here very proud today to represent the board and represent the work of the Louisiana Center for Health Equity. I'm going to say LCHE now. So, in doing so, the first thing I would like to say is Happy National Women's Health Week.
Melinda White, I represent the toe of the boot, Washington Parish. I live in Bogalusa. I'm proud to be a part of this, and it was just a blessing even to hear the beginning of this. I think that we were here, there was a purpose for us to show up when we did, to encourage one another, and that's what we have to do. As women, we must encourage one another, and we must set the path forward for our children to further, to go further. I'm proud mother of 2 daughters that can stand on their own. They sustain themselves, they do very well, and I'm very proud of that. I also have a son, too. But thank y'all so much for all the things you do, for bringing in so many today. Just as it touches my heart, and to know that there's so many women that can lean on one another. Because I tell you, this place will grind you down, and you've got to have pull strength from one another, or we never accomplish the goals that we set out to do. And we can never give up on that ever.
What Melinda said. I'm Mary Dubuisson. I represent District 90. That's Slidell, so St. Tammany Parish, and I'm happy to see all of you here today as well. And I'm sorry I wore my purple yesterday for Alzheimer's. Anyway, thank you. Enjoy the rest of your day, and we appreciate you.
Good morning, everyone. I'm Representative Rhonda Butler from Evangeline Parish, and St. Landry Parish is the district that I represent. And I'm so sorry for intervening on your meeting, but we do have other committees we have to be at. But I was so glad this morning when she came up and spoke about prayer. And I know at this very moment, God put me in this room because I have a special needs child, and she's right. God makes no mistakes. He makes none. That child has taught me humility. He's taught me to love unconditionally, regardless of race, religion, gender, rich or poor. God is all about love, and it's all about us and who we are. So stay positive. It's more than just about pulling up your bootstraps every day. It's about finding peace and joy. That's someone much bigger than us that controls all of that. So stay strong. We got you back, and we love you, and thank you for having us, and thank you for being here.
Good morning. I was trying to see if it was morning or afternoon. I'm Kathy Edmonston. I represent District 88 in Ascension Parish. Gonzales is mainly my district. And I like Representative Butler and my other colleagues, we just happened on this. We just heard about it for some reason, and I agree with Representative Butler. We were supposed to be here. We were supposed to hear that prayer. It gets really heavy doing what we do, just like all of you doing what you do. But we know that God has a plan and a purpose for all of us, and we're just so thankful that we're together as women and just pushing forward. And so God bless you. Thank you for having us again.
So we're here to join with you and to support you as you support us in the things that we need for our families and our communities. So as I was saying before, happy National Women's Health Week. Happy National Mental Health Month. And most of all, to let you all know that this year is our 10th anniversary for our state Women's Health Day in Louisiana. So happy anniversary for our 10th anniversary for doing this type of symposium, gathering, seminar, advocating for women and women's health issues. So just to tell you a little bit about what we're focusing on, LCHE that is, we have come up with a bold vision along with many partners, and that bold vision is called LA 40 by 2030. And let me tell you a little bit about that. So LA stands for Louisiana, and 40 stands for 2040. 40 stands for ranking, health ranking 40th by the year 2030. Now, this is a very bold vision because, as you all know, for women's health issues, we are 50th in the American health rankings, and we are always between 49th and 50th in state health rankings. But we're doing some different things, and we're promoting that, and we want you all to support us in this. We are actually looking to improve the health outcomes and quality of life for children and families in Louisiana during this decade. The goal is to improve the state's national health ranking to 40th by the year 2030. And I'm going to give you some of the measures for Louisiana that they look at across all of the states. We're looking at high school graduation rates. We're looking at obesity, smoking, low birth weight, cancer deaths, and children in poverty. So those are the measures that we're looking at. Now, in terms of measures that we're looking for women and children and to increase these measures as far as reports are concerned, we're looking at the maternal mortality rate. As you know, we're 50th for that. Low birth weight, infant mortality, preterm birth, child mortality, teen suicide, concentrated disadvantage, adverse childhood experiences, diabetes in women, food insecurity, and protective family routines and habits, which means that you go to the doctor and get your, annuals and, just making sure that we do everything we need for health. So that's our VOLE vision. And when I say ours, I mean LCHEs along with many partners. And these are the things we're looking to affect, to bring us from 49th and 50th up to 40th. So we hope that you all will be with us. It's not a short-term thing to do. We'll be working with this over the entire decade. It's going to take a while for us to move the numbers, but we're in it for the long haul, and we hope that you all are with us in looking at increasing the health of women and families in Louisiana. So I thank you all very much. The board appreciates you and appreciates you for being here, and we've got work to do, so let's do that work. Thank you so much for listening this morning. Thank you.
Good morning, everyone. Renee Antoine, Executive Director for the Office of Women's Policy within the Governor of John Bell Edwards. The Governor's Office of Women's Policy supports public policy that promotes the educational, health, social, and economic well-being of women and girls in Louisiana. A primary function of the office is to serve as a connector between nonprofits, state and federal agencies, educational institutions, legislators, and concerned citizens to promote effective collaborations to further the status of Louisiana women. This includes working collaboratively with the Louisiana Legislative Women's Caucus and the Louisiana Women's Foundation. The office also provides support for the leadership for Louisiana Women's Policy and Research Commission, as well as the Domestic Violence Prevention Commission. And today I'll be reciting a proclamation on behalf of Governor John Bell Edwards. Whereas National Women's Health Week, celebrated this year from May 8th through 14th, 2022, commemorates the progress in women's health and recognizes the work that is still needed to improve the health of women for future generations. And whereas, in honor of National Women's Health Week, the Louisiana Center for Health Equity, LCHE, is hosting its 10th Women's Health Day and Retreat on May 12th at the Louisiana State Capitol. Whereas LCHE gives voice to the needs of women of all backgrounds and provides them the opportunity to improve their physical and mental health through information and education that will inspire them to take the next step toward creating the foundation for a lifetime of good health. And whereas women of all ages, races, backgrounds, and every socioeconomic status have varying needs at varying stages of life that require a unique approach in their path to health and wholeness. And whereas women acknowledge the support and advocacy of women's health through the various partnerships with social, health, and other organizations that help promote and improve the physical, mental, social, and spiritual health and safety of women. And whereas it is important to recognize the women's health includes ensuring women's ability to have access to resources and care, not only for themselves, but for their families as well. And whereas recognizing that women harness the power of their collective voices through community meetings, organizing, and most importantly, by voting to effectuate meaningful change and improve health outcomes for themselves, their families, and their communities. And whereas women's health remains a priority for families, communities, and government, and our commitment to keeping women healthy is stronger than ever in Louisiana. Now, therefore, I, John Bell Edwards, Governor of the State of Louisiana, do hereby proclaim May 8th through 14th, 2022 as Women's Health Week in the state of Louisiana. Thank you.
Good morning, everybody. I am happy to be here again another year, and I just want to say to Ms. Stewart, I used to always call her Dr. Stewart, right? Yeah, because she acts like a doctor. You know, yeah. You know, despise not the days of small beginnings. because at some point, that acorn turns into a pecan tree. And today I see the flourishing of that tree coming forth. Yes. And then I'm going to give you Galatians 6:9. Let us not grow weary in well-doing. She has been on this battlefield with many of you for a long time. But she shared something with me the other day, and it was kind of funny, and I was like, I feel you. She's like, I'm getting older. She said, yeah, and my days are getting limited on this, but, you have sowed the seeds and laid the foundation for something that's going to grow far beyond you for years to come. Amen. Amen. Let's give her a hand of applause. And for all the ladies and organizations that have been working with her, I'm just going to ask you to stand, because nobody ever get to their destination by themselves. A good friend of mine's, a former, he is a former state representative out of Georgia. He said, if you see a turtle sitting on a fence pole, just know that he didn't get there by himself. And that is very true. So look, I want y'all to stand. If it's the whole room, then the whole room just stand. Yeah, give yourself a hand of applause. We have come a long way in this state as women. From when I first started, I can tell you that. At least if we have, and it feels that we have a lot of work to do. And we may not always agree on all issues, but at the end of the day, one thing that I think is at the core of all of us is the importance of women moving forward and having opportunities, having the chance to be able to fulfill their God-given purpose. Now, I'm going to tell you, none of that is on my list. I wrote down notes of things that I wanted to say, but none of that is on my list. So I'm going to try to get back to my list. I want to welcome all of you for being here. 10 years is nothing to sneeze at. There are many organizations that start that never make it to the 10-year mark. And so I want to congratulate you guys on that. And hopefully many of you will still be here when we go in on the floor today, so we can recognize you on the floor and just let all of the world see, especially Louisiana, know about the great work that's happening with this organization and the goal of 40 by 2030. Amen. I am working with Mrs. Let's do it anymore, right? Allen. I got to get all that right. Not Dr. Allen. Getting some funding to help towards this initiative. So we are working on that now with the department to get that money. I just want to say real quickly, I serve as the chair of the Select Committee on Women and Children, and many of you may have seen a lot of our work during the interim regarding power-based violence, a lot of things that was happening on the university campus, which I am glad to say that we've been able to make some headway. It's not where we want to be, but I can tell you one thing, it's not where it used to be. And there's some accountability that's happening on that arena and in that space. And we got money allocated to address some of those issues. Also, I serve on the finance committee. That's one of the big topics, and that's what's been keeping me running a whole lot here, Lady Charmaine. I've been running day and night because we have more money, right? So we have ARP dollars, we have money that's come in as a result of the hurricanes, we have some infrastructure dollars that are coming in, but all of this money is one-time money. So that means that it cannot be used in our budget. And a lot of times when people hear that, they are thinking that we can do a lot of things that are reoccurring, but we can't. So because of the Constitution, it's limited in terms of how it can be spent. However, one of the things that we are doing that I am happy about is that we are giving teachers a pay raise of at least $1,500, and hopefully that can turn into $2,000. And support workers are going to get a raise as well, $750, that we hope to bump up to $1,000. So we're making some strides. Amen. It's still not where I wish it could be, but it's better than where we were. And like I said, because of the work, because of the push of many of you who are in this room, that's why we are beginning to see some of these efforts come to fruition. Lastly, I would say I serve on the Health and Welfare Committee. I've been on that committee since I've been elected. It is one of the things that, to me, is one that I am most concerned and dear about, because if a person don't feel well, then nothing else really matters. They can't go to school, they can't work well, their entire life is affected if they're not feeling well. And so, yesterday, we had a very interesting day in committee, and I see my sister right here. I know you were there, and I'm not going to rehash everything, but we were so disrespected in that committee. It was a level of disrespect that I have not really ever encountered since being elected, honestly. Not continuous kind of beating on an issue. We can always disagree, but it's always a way to disagree. And as legislators, we are human. We are people just like everybody else. And we have issues going on in our life personally that people may not be aware of. We don't make those things public, but we show up and we try to do the best we can, because nobody is perfect. Nobody gets it right 100% of the time. And some of the things that were said were just so ugly. And so I would say, I think COVID has done a couple of things. COVID made people be isolated and forget how to treat people. And I heard last night, I love Stephen Colbert, but somebody said, I think he had the guy, the lady that was on there doing some jokes, and she was saying because of COVID, people have forgotten how to interact with people. So, it's like you need to teach them again how to treat people and how to talk to people. And I was like, you know what? I think she's right about that, because what we endured yesterday was really harsh. But I am committed to health care, committed to ensuring that we have access to health care. And so with that, I don't know, along those lines, myself and Representative Marcel have the same bill, pretty much the same bill that creates the Office of Women's Health, which to me goes back to the goal, right? Of reaching, having the outcomes where you have measurable outcomes, especially for women, which impacts families and children by 2030. So I'm looking forward that one of those bills is, I hope one of them gonna make it to the finish line. We need one of them to make it, so that we can have this office created. And I believe that we'll begin to see even more improvement, because you can measure better, because there'll be that level of continuity in this care of services. Then lastly, as I get ready to go to my seat, I serve on 2 other committees. These committees are extremely important. I serve on labor. I have been fighting, as well as my colleagues, we've been fighting, Lord have mercy, Melissa, on trying to raise minimum wage. I'm so frustrated with that, I don't know what to do. I thought I had the most compromising bill ever. It was tied to the CPI, and it would only move with the index. You can kind of know it's only a small percentage. It would go up, but at least it would start moving, right? We're gonna have to come up with something, ladies. We represent most of the electorate. We're gonna have to put more pressure in that area as it relates to people being able to earn a decent wage. People want to be able to be paid for a decent quality of life. They want a decent quality of life. People don't, I am so convinced of this. People do not want to be on subsidies. They don't. 99% do not. You have 1% that probably don't matter. But most people want to be able to earn a decent living and not have to work 4 and 5 jobs. And I've been a part of that fight since I've been here. And I'm not going to stop, because one thing I have learned is that, while we want to stop fighting, we can't stop fighting. We have to keep fighting. And then lastly, for me, housing. I did something really bold and courageous this session. I was going to dismantle one of the Louisiana Housing Corporation, because I was very, I have made it very, so I'm going to be careful how I say this, because I see I'm on TV or something. I want to make sure housing is a core component of being able to have a quality of life. Housing and transportation, along with other things, right? But those are core components. And I made it very clear that while I see all this money coming into our state, all this one-time money, which can go into some of these areas, one thing I want to see a intentional effort on is making sure that we have affordable housing for people. So I think we got that commitment, but I can tell you right now, I will be following up. We got our resolution that's going into the hopper so that we can make sure that that's happening, but I believe that we got the right people in place to ensure that across this state that we have affordable, decent housing that people can live in. So again, thank you for all your work and your effort. I want to, where did Ms. Stupid go? Oh, there you are. Thank you for making the comment that y'all have our back. Yes. I appreciate that. Thank y'all for having our back, and thank you for all the work that each of you do. Ms. Renee, good to see you. Thank you for all that you do, all of you. God bless you. I love y'all. And trust me, I could not be here if it wasn't for you, because I know that y'all been praying for me. I know that you've been standing in the gap for me, because it's not been easy for me either to get up every day to get here. Some days have been harder than others, because when you've been married to somebody for 35 years and then you go home and they're no longer there, that's not easy. And I know I'm not the only one in that boat, but I know one thing. It's because of women like you standing in the gap that I'm able to keep moving forward. Thank you, and God bless you.
Good morning. So my friend, Representative C. Denise Marcel, she said, I need you to come up with me to this women's luncheon. And when I got up here, I was presented with a corsage. I was asked to sit at the table, and I was like, what in the world has she gotten me into? So what I will say is God puts you where he wants you to be to receive what it is you need to receive. I post inspirational posts. I use my social media for good. For the last 10 years, I've done inspirational posts Monday through Fridays on Facebook. And my post today was from Colossians chapter 3, verse 2. Set your mind on higher things and keep it set. So today I had a challenging bill myself in labor, fighting for equality for all. And as Senator Barrow said, we have a fight ahead of us. So my call to action to you, to this room filled with women, is to know that we can make a difference. We will make a difference when we decide to not only engage here, but engage our community, engage our neighbors, engage our families, engage our organizations when it's time to vote, and be consistent with voting. We can't show up one time to get Governor John Bel Edwards elected and then sit down, because he needs support in these committees that Senator Barrow spoke about. We need support in the committee that I was before today. And what I said when I left to those that were there with their green cards to support me, I'll be back. You know, they shot it down today, but guess what? I'm bringing it back next year. Hopefully, to a new set of faces that understand that women, people, black, white, Hispanic, whatever, we're all equal in the eyes of God, so we should all be treated equal. One of my closing statements before they voted my bill down was, understand that the world is evolving. When the world evolves, we have to be accepting of what God is evolving it to. Once upon a time, women weren't allowed to vote. Once upon a time, African Americans weren't allowed to vote. But here we are today, but still fighting the fight for equal pay for women in 2022, right? There's a rep, and you can go look it up. I refuse to name names today that said women shouldn't be paid equal pay. Men work harder. In 2022. So my call to action, and I'm gonna sit and Melissa, stop. My call to action is, we are running up on midterm elections this year. Next year, we will have statewide elections for senators and state representatives. Be very intentional with your vote. Please pull these bills and see how the people who are representing you and your interests are voting. And then be intentional about telling your neighbors to get out and vote. And each organization you're with, reminding them, because we know, we follow, we keep in touch, we're engaged. Society as a whole are completely disengaged with our system. But understand it doesn't stop the system. So laws and legislation will still be passed every year. We go into session every year. So that's my call to action. Midterm elections this November, state elections next year. Be intentional. From here on out, I'm charging you with the responsibility of telling hundreds of people about these elections that are coming up, and let's change the face of government. We can do it together. Thank you.
I am C. Denise Marcel. I represent District 61, which is right here in Baton Rouge, Louisiana. I've been a friend of, I still call him Miss Stewart, Miss Allen, Dr. Allen, when I was on city council in Baton Rouge. And so I want to commend you and all of the organizations that you work with on 10 years. I think that's awesome. I've seen you get down in the dirt and really, really grind. And so I want y'all to give her a round of applause and that organization. And let me just tell you guys, Ms. Alma came to me and asked me to carry the bill for Office of Women's Health last year, and then again this year. And she's so passionate, and I'm so focused on counting votes when I'm doing my bill. She's got to call every organization in America that's on these bills, right? And she likes to talk about the statistics, and that's really great. But when I see I have the vote in the room, I'm hitting her leg. Stop it, Ms. Alma. So she's very, very passionate. She comes to the committees. She fights not only when it's the legislation that she's asked me to bring, but when it's other legislation that concerns women. And I see some of us, we're very focused and straightforward on whatever that is. Some people want to do reentry, prison reentry. Some people want to do health, education. But she's all over the place with this legislation. And this year, she also asked me to carry a piece of legislation for children, to assess children. And do you know, I ran into a problem on the House floor trying to do something to make sure that when our children are being expelled or suspended, that we would have a tool to find out what's going on with those students. It is amazing in this building what we go through. We look like I got tough skin, but some days it really gets to me. When I carried the bill on Office of Women's Health, there were 2 women in the House of Representatives that voted against creating the Office of Women's Health. And I am not as nice as Delisha Boyd, Representative Boyd. I will call their names. And that was Burl Amity and Dodie Horton. I'm trying to figure out in my mind, even though the bill passed off the House floor, why would a woman vote against creating the Office of Women's Health? So this morning, I could tell that my colleague was a little down in her spirit. She's new here, and she came here thinking like me when I came here, that everybody was going to be this big kumbaya party and everybody was going to do the right thing. And so I came in on the end of her bill and I saw the disgust on her face. It is so disrespectful in the committees and the way they're made up to vote against anything that is about women, people, equal pay. And what's amazing is Senator Barrow is my senator, and I'm just finding out we got like 3 bills, not 1, not 2. So that means we really think alike, right? We got 3 bills, and they told me yesterday I was carrying a bill with the children. I said, well, Senator Barrow has a similar bill. Can y'all marry these bills? I said, well, me and Senator Barrow just need to get married. So I'm tired of her carrying all the same bills that I'm carrying, right? Even the minimum wage bill. So I'm gonna go back to Representative Boyd for just a moment. And I could see like she was just drained. And I said, look, you need to come up here and go up here with me, right? And then we went outside the room and we talked to some other women. And this is what she and I said to them. We need to mobilize. If we got all of these women, and women vote, don't women vote? We outvote anybody else, right? It doesn't matter what color we are, we all vote. So why is it then that we keep sending the same crazy people to this state capitol? I mean, really. And we've got to be, I talk to the people in my district about taking money to be on campaigns. We got to stop that. We got to stop that foolishness. Well, whoever pays me the most money, well, that's who I'm going with, and that's who I'm going to push. But we got to look at what that does to our communities, what that does to our policy, because that's where we're lacking at. When we can get people to pick us off one from the other and go with this one because they're paying more money or they have the bigger coffer, we are in trouble in this state. And I mean, this session is like none other for me. I literally wanted to walk out. I did walk out of criminal justice and say, I'm not coming back. I'm tired of voting in here 9-1. I'm just tired. And it gets to be really draining. And then I went and I heard a message from Johnny Anderson's brother, the prayer breakfast, and it gave me just what I need. Even if you got to stand by yourself, just go ahead on and stand. And so sometimes we need encouragement. People call us to do things, but sometimes we need encouragement, right? Because we're fighting on the front line and we're constantly being injured. It's like being in a war and you're going out there and you know you're going to get shot because you're on the front line, but you go anyway. And so I just want to thank you guys for your work, but tell you to continue to lift us up. Continue to have our backs. And please, ma'am, please, sir, because I see some men in the room, please mobilize and change the people that we are sending here to represent us. And many of us have different views on some issues, but we should be able to come together on many of these issues. And this is not just in Louisiana, this is across the nation. They are disrespecting women and their bodies, and I'm really tired of it myself. So I just want to thank you for allowing me, and thank you for allowing me to carry your legislation and for working with you over the years. I will continue to stand on the front lines, even though sometimes I'm wounded. I will continue to come up here and fight for minimum wages and fair wages for women. But we need y'all to have our backs in the streets. In the streets. Somebody say in the streets. In the streets. I'll meet y'all in the streets in the fall. I'm going to meet y'all in the streets. I'm going to hold y'all to that. In the streets. Because that's where it starts, in the streets. Thank you very much.
I'm going to talk to y'all today about what I hope is an inspiring set of programs that our office runs in Louisiana and will be running to focus on women's health, especially in the maternal and child health space. So as she said, I'm Brittany McAllister. I work in government affairs for our National Service Office for Nurse Family Partnership and Child First. Nurse Family Partnership serves pregnant, low-income mamas who are early in their pregnancy, and they work with them all the way until the baby turns 2 to focus on health goals, life course goals, anything else that they need to have a healthy pregnancy and a healthy baby. Child First works with women and children and caregivers who have mental health challenges up to age 6. So we wanted to highlight how our programs can and do make a difference in women's health in Louisiana and could do so even more if they were expanded to serve more of the population. So I'm going to give a quick overview of both of our programs, and then we can take any questions if we have time. I know we're running a little bit behind, so I won't belabor anything here. To start off, we're going to play a quick 4-minute video to kind of raise our spirits and talk about how these nurses help serve the moms in need.
When I found out I was pregnant, it was the summer before 12th grade. I was so scared.
It was really difficult not having my mom, my dad. As an immigrant, I didn't know how things were working here.
I was at rock bottom, and I found out I was pregnant. I want better for myself and better for my life and his life.
Prenatal and infant and toddler development may be the most opportune time to make lifelong effects on human development and health.
Nurse-family partnerships intervention offers a multi-generational effect. Strong moms raise strong children become strong parents.
With Nurse Family Partnership, we support families in meeting their health and wellness goals for their physical health, but also what it means to be a healthy family.
When a mom has confidence in herself and her abilities, she's going to translate that down to her child. It's going to allow her to work with her child throughout many years as they deal with other challenges that they're going to come up against. When you talk with our moms, most often they have challenges such as homelessness, addiction, they're socially isolated, and that's where Nurse Family Partnership comes in.
No solamente la palabra, sino en dos idiomas.
I feel like I'm the support for them, but they're learning themselves, and it's amazing how they learn that they have the power, that they're powerful.
I was in a very bad spot when I found out I was pregnant. I was getting high. I was very nervous and scared. And then I finally sat down and thought, and I went to John Brooks Recovery Center, and I got put on methadone.
It's very common when somebody's going through addiction to have some type of trauma, something that happened in their life that they are trying to cover their pain with their addiction. So I helped her with resources to start counseling.
Dawn helps me with everything, learning how to take care of his needs and take care of mine at the same time.
James is a very happy, alert baby. His development is right on track. Now he's already attempting to try to crawl. He's a gorgeous baby.
Dad. Katie has helped me with a lot, and I think she might be my biggest supporter, honestly.
With Becky, I feel she replaced not having a family. She feels like family. She is family now.
She's always there. It's not just for the nurse part. She's there for everything.
I can't imagine having done all of this without having been in the program.
We see long-term effects of the intervention and outcomes that are of unquestionable public health and social importance.
Since 1996, we've reached over 269,000 families.
Thank y'all. So hopefully that gives you a good overview of our program. Nurse Family Partnership is currently in every parish except 6 in Louisiana, is implemented in every region in the state. Our program, as you may have been able to tell, has 3 primary goals. That is improving pregnancy outcomes and maternal health, improving child health and development, and then also setting goals and improving economic and other life course actions for the family. Our vision is a future where all children are healthy, families prosper, and poverty cycles are broken. So our multi-generational approach shows outcomes not only in the mom's life and the baby's life during that 2-year period, but also their life course as they go on, become adolescents, and eventually become parents themselves. We have kids who are babies in the NFP program who go on to become nurses in the NFP program. We have teen mothers who go through our program and decide they want to become a nurse and help folks who were just like them a few years ago. I am trying to click. Let's see. Not working. There we go. Sorry. Okay, so we use registered nurses to provide a community health nursing intervention. Those nurses are working with the moms to work on pregnancy, early development, and use the proprietary, unique NFP model of nursing care. Our program has the most extensive evidence in the field. We have over 45 years of evidence from randomized controlled trials that show for similarly situated women, someone who goes through the NFP program versus someone who doesn't is going to have better outcomes. That includes on health and more cost savings to government and society even. Our nurses work in the homes of these mothers or anywhere else that they might need to meet to have a safe visit with their nurse. So that could be at school, it could be at McDonald's, it can be at their place of work, wherever they need us to meet, that's where we're going to go. Our nurses work with those moms to provide visits on a weekly, bi-weekly, or monthly basis, depending on the needs of the family. We really work with those moms to say, what's going on in your life? What do you need? How can I help? And then meet them with those goals. The program is situated in those first 2 years because that is the most important time for child development and lifelong development, because there are so many new neural connections forming in that period, that the family's actions toward that baby in the first 2 years will have lifelong consequences. So this is a map of where we're currently located. If you haven't heard of Nurse Family Partnership yet, let me know. I'll give you my card. We can certainly connect y'all with the nurses in your area. We have been around since 1999, and we are implemented through the Bureau of Family Health, through LDH and the Office of Public Health. We serve low-income women exclusively, so our moms are generally either Medicaid or WIC eligible. We try to reach them as early in the pregnancy as possible so that we can have the greatest potential to work with them during that pregnancy to improve their health outcomes. So that's usually before the 28th week or so of pregnancy, and we work with them all the way until the baby turns 2, and that's when they get to graduate and go out and use the lessons that they've learned to be a good parent. This is a quick snapshot of the demographics of our clients over the last 2 years in Nurse Family Partnership in Louisiana. As we all have just been through the COVID pandemic and still are, this snapshot may be a little bit different than what we would typically expect, but we really saw that those needs only increased during COVID. So while we typically go into homes, we did have to shift to providing exclusive telehealth for a while. So we were providing video and phone visits to families. We worked with families to get them cell phones through a partnership with Verizon when they didn't have access to do so. But now that we're back in the home in most cases, we're able to provide a little bit more effective care. So our clients are predominantly young. 22 is our median age at intake. We serve a significant portion of teenage mothers as well. Most of our clients are enrolled in Medicaid, and if they aren't, we connect them with resources to help them get that coverage. Our clients earn less than or equal to $6,000 per year annually, so many of them are deeply impoverished. We serve about 60% Black or African American clients and about 6% Hispanic clients, which is a little higher than the representative of the population in Louisiana. So to give you an idea of when we do all this work, what actually happens in this family's life. So there are lots of outcomes I could share with you at length, but these are some of the highlights from the randomized controlled trials. And we see a 48% reduction in child abuse and neglect. When those parents are taught how to actually care for your family, when they're given those skills to overcome some of the challenges in their life that lead to some of those situations, there's a reduction in that and a reduction in involvement in child welfare accordingly. We also see a reduction in visits for accidents and poisoning when parents are better able to care for their children. We work with them on language development for their children so that we see a reduction in language delays, and that also pays off when it comes to entering kindergarten or pre-K. The children of NFP mothers are more ready for schooling. We also see fewer behavioral and intellectual problems at that age. We have a reduction in closely spaced pregnancies, which we know is a really important indicator for women's health. We work with moms on contraceptive access, contraceptive counseling, and anything related to their life course goals around having more children. We also see an increase in months of employment, and even as that mother and that child are out of the program and go on with their life, we see a reduction in arrests and involvement with the criminal justice system. In Louisiana, this is again a snapshot of our COVID era outcomes. The women that we work with are severely disadvantaged and face more challenges than the typical population. So these numbers are actually pretty close to the average Louisiana outcomes for many of these issues, but not for the representative population that we serve, those outcomes would be lower. So we help improve and reduce preterm births. We help improve breastfeeding rates at the newborn's beginning of their life and at 6 months. We also help ensure that those children are getting well child visits and are getting their immunizations. We also have an impact on months of employment for the mother, for mothers who wish or need to be employed. In Louisiana, we are funded exclusively publicly. We are implemented by the state, and this is just a quick overview of some of our funding sources. And as advocates, I would just ask you all to advocate for continued and sustained funding for our program so that we can continue to serve the moms that we do. Now, moving on to Child First. I'm really excited to share this program with you because it is going to be brand new to Louisiana. Child First is in a handful of other states, but will be coming to Louisiana as we just signed our contract this morning. So that's been going on for a while. Child First is a home visiting model that uses mental health clinicians to serve caregivers and children with mental health challenges. We have a two-person approach that uses a master's level mental health clinician and a care coordinator to stabilize families when they're facing crises, to help heal trauma, build resilience, and protect them from future adversity. Just like Nurse Family Partnership, this service is completely free to the families that we serve. The mission of Child First is really centered around intervening with those children and families when they're having the greatest challenge of their life, the earliest possible time to prevent that adversity from taking over the family. We have goals of decreasing child and parent mental health problems, promoting child development and learning, preventing child abuse and neglect, building nurturing, responsive caregiver and child relationships, and addressing social determinants of health. Child First is founded on the idea that relationships are powerfully important to lifelong development. These early, responsive, and nurturing relationships can protect a child's developing brain from the damaging effects of toxic stress. Child First helps toxic stress become tolerable stress for these families. Our theory of change is a direct response to the science of early brain development, and so we help decrease stressors through connecting them to comprehensive and community-based services and supports using our care coordinator, and then promoting that responsive, nurturing, protective parent-child relationship through what's known as parent-child psychotherapy. So as we come to Louisiana, we're also going to be, let's see if I can get this to load, having an impact on the mental health workforce. We are expecting about 36 care coordinators and clinicians to be hired through the DCFS funding in certain regions of the state, and giving them the training in this intensive, unique child-parent psychotherapy model to help them be a part of the community and a part of that mental health and early childhood workforce so that they can not only make a difference with those parents, but also make a difference with early childhood education providers. So this is a really unique and important part of our model. A lot of families get referred to Child First because they're getting expelled from daycare. I know we talked about expulsions for older children earlier. There are young children getting expelled from daycare because something's going on with them, something's going on with the family that they need help with. And so not only do we just take the referrals from those early childhood providers, we work with the teachers and the folks at the center to figure out what's behind that behavior, what's going on with that child. How can the caregivers in that early childhood setting be more responsive and help shape them and help the issue instead of just expelling them and hoping that things just figure themselves out. And this, of course, as you can imagine, has a positive impact on the other children in the setting as well, not just our clients. So our clients in Child First are not necessarily income-based. It's any caregiver facing multiple challenges in their life of any sort. That could be poverty, intimate partner violence, homelessness, substance abuse, mental health challenges, unemployment, impacts of systemic racism, any trauma in their life. We want to step up and try to help them address that and move forward. We also work with, so the caregivers can have a mental health challenge or it can be the child, and really just depends on the individual family, because all of these factors can increase risks for abuse and neglect and decrease the chances that this family is going to be successful in staying together as a family and not having child welfare involvement. The randomized controlled trials of Child First similarly show that folks who were involved in the program have improvements in child behavioral health, child language, improvements in caregiver depression and mental health issues, reductions in child welfare involvement, and a huge increase in access to requested and needed services. Our plans in Louisiana, as I said, we signed our contract this morning, so we will be receiving Family First Transition Act funding through DCFS to serve families throughout Louisiana and a few select regions, which they are going to announce at some point. So we're really excited to bring this new program to Child First, and so with Child First and Nurse Family Partnership, as part of that continuum of services available to pregnant mothers and families with young children. We hope that we can work with the most vulnerable folks to help improve those outcomes. Now, if we were to expand these programs and really reach every single person who is eligible for these programs, we could start to move the needle on population health level. So that would be my ask of you all, is to help advocate for expansion of the funding for these programs so that we can really reach every single person who could benefit from them, as they are the most vulnerable in our state. This is my contact info. If you want to connect to local folks in your area, I'd be happy to do that, or talk public policy and public funding with you. Feel free to find me after this or shoot me an email. Thank you all so much.
I just want to thank you all, because I think I'm a rural senator. Senator Barrow and I were talking about how important it is when we try to find answers. I see Libby here. We talk about this a lot. When we try to find answers, the big problem I see is we can put all the resources in the world, and if you can't find them, we're wasting our money. So much of what we've got to do is connect people to the help that we're trying to provide, and that's the challenge. I mean, urban areas, I can tell you, we don't have broadband where I'm at. I talk about it all the time. There's a level of expectation that is not the same across the state. So there's a lot of things that we need to do to give people equal access to the resources we've got. I'm open to whatever we can do. Senator Barrow and I work hand in hand on a lot of things. And with that thought, she and I were just talking about when we have an idea, the staff we have in the Senate, and I know the House has great staff, but the Senate staff, we can tell them this is what we're trying to do, and they find the way to maneuver through the bureaucracy to get us to a place where we can offer some answers for our children. We all want the same thing. We all want, I just left these fights in education. We had a room full of people fighting, but everybody there wants the best things for their kids. We just have different ways of seeing it. So I hope that we can come together and figure out how we can get what we need to get to the kids, the mothers, the families, and I'm here for whatever I can do to help. Thank you. Thank you.
In terms of health outcomes, Louisiana tends to rank at the bottom or near the bottom. We fluctuate just a little bit, but we're usually either at the bottom totally or a little bit above the bottom. And so what we know is that we can do better. We know that other states have made drastic improvements. The program that we just talked about today, the Nurse Family Partnership, which is a national program, is an excellent model for Louisiana. We actually do have a program here, but the program is under-resourced. It does not serve enough. We were told 10% of the eligible population can get into or receive those services now. We can do better. We need to put more funding and resources into programs like that, where we can actually reach those families that are in need.
How can people get more information about your organization?
Yes, we're online. They can just go to Louisiana Center for Health Equity. We pop up. There's the number. If there's any info they need, they can go to info@healthequity.org.